As India begins to reopen after a devastating second wave of coronavirus infection, concern among virologists is growing that another possible more virulent version of the virus could hasten the start of a third wave within just a few months. The version, which has become known locally as Delta and Delta Plus, is described by scientists as a highly contagious variant that has spread rapidly through India, Britain, United States and other countries. The new variant carries a spike protein mutation that can spread rapidly and may cause appearance of a new variation of symptoms. In this video, we will know what is the Delta and Delta Plus variant of COVID-19, its symptoms, and we will also know is vaccine effective against it. So stay tuned with us to know more and subscribe the channel if you haven't already. A highly infectious new strain of COVID called the Delta variant is rising among all over the world. This variant B.1.617.2 was first identified in India, earlier called as Indian variant, and is a variation of SARS-CoV-2, the virus that causes COVID-19 disease. It has been named after a letter in the Greek alphabet as per the guidance from the World Health Organization on naming variants of concern. The Delta variant has gone under mutation that makes it easier to latch on the cells in our bodies, therefore has greater potential to cause outbreaks. So why the world is worried from this strain? That's because research suggests it may be the most transmissible variant yet. The Alpha variant, first identified in England, was previously believed to be the most transmissible than the original form of SARS-CoV-2. However, the Delta variant has now overtaken this. Experts believe it is between 50 to 60% more transmissible than Alpha. It sparked the huge wave of infection across India in the second wave, and now it is causing a concern in the UK, where it comprises 91% of new cases and it makes up more than 10% of new cases in US. It has also spread to 74 countries worldwide on every continent apart from Antarctica. Apart from the spreading capacity, research suggests it can also causes an increased risk of hospitalization, and thus the WHO has classified the Delta as a variant of concern. Fever, cough and loss of smell are the classical COVID symptoms. However, a new study shows the symptom may be changing due to the rise of Delta variant, such as headaches, sore throat, runny nose are the most common and seen symptoms in this new strain. Vaccine. Do they work against the Delta variant? Several studies suggest that Delta variant seems to be the stronger resistance against vaccine than the other variants. But this also evidence that COVID shots are working against it. Latest research suggests that AstraZeneca, that is Covishield, has 92% effective in preventing hospitalization after 2 doses. So people need to be fully vaccinated for these 2 doses to be effective. Again, early study shows that Covaxin also offers protection against this Delta variant. The variant called Delta Plus was first reported in a Public Health England bulletin. The new Delta Plus variant has been formed due to a mutation in the Delta or B.1.617.2 variant. The mutation is the result of the Delta variant acquiring the spike protein mutation, that is K41.7N, to form what is scientifically known as AY.1 variant or Delta Plus variant. The above mutant was first detected in Europe in the month of March 2021, and it has come to light on June 13th, and now the new strain is in 9 countries including India, US, UK, Russia, causing a variant of concern. In India, experts in Maharashtra have warned that this variant might affect more than the first and the second wave and might be increase the COVID craze overall. So the bottom line is that viruses are meant to mutate and there is no definite answer that to how many times it will change. Vaccination is very important, but no one is safe until everyone gets vaccinated. A thing to remember that COVID is still very infectious and it's important that we don't let our guard down. Wearing masks, washing hands properly and maintaining social distance should be our concern. That's all for today. Stay tuned with us for more health related updates. Subscribe the channel, like the video and share with your friends and families. Take care.